Welcome to the David Avocado Wolfe Podcast. This show brings you David's revolutionary ideas on radiant health and personal growth. With over 30 years of experience and hosting more than 3,000 live health events, David has inspired millions worldwide to live their best lives ever. Are you ready? Let's get started. Today is the best day ever.
Greetings, David Avocado Wolfe here. We've got an awesome program for you. This is actually one of those deprogram programs where we're going to get into real integrative, rejuvenating longevity medicine and deprogram us out of the big pharma disaster. This is really going to be an important show for those of you who are getting into that age group where you're like, maybe you're early 40s, maybe you just turned 40, or you might be 50, or you could be in your 60s or beyond, because the answers are here. The technology is here. The ideas have been well elucidated and checked out over decades at this point. And so what we've done is we brought you my personal doctor onto the program, Dr. Iman Bar. She is so epic. And I just stumbled into her. It was the most amazing thing. We were going to have some stem cells. I had my stem cells extracted from my fat, and they were in a bank in Florida, and you call them up like 3 weeks before, and then they multiply them. So the idea with stem cells is you want your own stem cells, of course. So let's say, when you're 15 years old, you might have 1 billion stem cells circulating in your blood. By the time you're 65, it might be 150 million. So that's an 850 million delta. So you could actually just take your stem cells that are already banked somewhere that have been extracted from your fat, for example, and have them multiplied to 850 million, and then just put them in an IV bag and drop them into your system. So I did that, and the person who came up nearby, and I was in Southern California, was Dr. Iman Bar, and that's how we met. And she's just epic. She's got all these protocols. She's going to lay it down for us. I guess with no further ado, Dr. Bar, thanks for joining us.
Thank you for having me. My pleasure.
Your protocols are so great, Dr. Bar. I want to get into your entire theory of aging, and then when we're like, okay, we got the stem cells multiplied. That you're like, no, we have to do the prep day before. We have to do peptides, and we got to do this and that. I was like, well, this woman knows what she's talking about. Take us through your theories of aging and what you do at your clinic in Southern California.
Thank you for that introduction. It's not my theories. There's a lot of research behind it, and I think the hallmarks of aging are expanding as we're talking. So we know we have like 13 hallmarks of aging now that we can actually address, and we can consider aging as a chronic disease, and we don't have to go through it, and we can just live our fullest life to the very end, and then we go. This is my plan. So we know that humans have the genetic code to be able to live and there are a lot of biohackers thinking that way, up to 120, 130 years. However, or 110 maybe for with some genetic code. But unfortunately now, the average lifespan is maybe 75. Even in the United States, it's so sad. So we do have that genetic capability. However, the changes that have happened through the environment over the years, which is the epigenetics, is what has, determined that our DNA is not functioning as well, and we cannot really achieve that longevity. But we're working on it now that we have identified all these hallmarks of aging, and I've outlined them in my book. I'll send you a copy, How to Biohack Your Stem Cells. So the first thing I usually address is the hallmarks of aging, because these are the things that we can reverse. And one of them is stem cell senescence, which is our stem cells age as we go. And this is something also we can reverse. So the hallmarks of aging, we have a little teeny pie that I showed you in the beginning. The most important thing that we address when we have our clients coming in and we want to just reverse their aging. So we know that I get your age, I get all the, kind of biologic markers. We do some labs, but actually the new technology that we have now, we can measure your biologic age, which is how is your cells aging? So a person could be 40 years old when we look at their driver's license and get their information. However, we draw their blood and their DNA, the cellular level of health might be 35 if he's doing good or she's doing good, or it could be even 45. So it could be either way. And now we know we can reverse that scientifically. So these are the biologic clocks that we measure. There is a lot of biologic markers that we check for patients. There's a brand new gene that we have identified. It's called, one of my buddies, Dr. Cleaver, is the Clotho gene that he's doing a lot of research in right now. That is, we're going to hear more and more about it. So Clotho gene is something that determines aging, and then we can absolutely now, he's working on getting that as a supplement that we can take. But there are so many things that we know we can influence our Clotho gene. The other thing that is important is that we measure DNA methylation, how your DNA is aging. So the top part of my chart, or the pie that will show some point, is the top part. The purple part is your DNA, your epigenetic factors. So a person is born by a certain DNA and telomere length. This determines how your DNA divides every time you need it to go through. But with environmental and epigenetic factors, we start having DNA damage. We have mutations, and epigenetic factors, like environmental factors. Somebody smokes or doesn't exercise or have a sedentary life, or is like eating so much, kind of junk throughout his life and not watching. The epigenetics is what turns our DNA code on and off. So when somebody says that my DNA, is like, I am not going to do well because my mom and dad didn't have good genes, I think that doesn't even determine more than 30% of how an outcome would be. Epigenetics is like determines the rest of it. And we know now the environmental factors are the ones that determines how we're going to survive and have a good longevity or a good lifestyle or a lifespan. A lot of people talk about lifespan. So the next part of our aging pie was like the pizza pieces is we know that mitochondria is huge. We check your mitochondria's levels. We do testing for that. And then mitochondria is your powerhouse. It's what determines how your energy is going to be created in every cell in your body. So we learn now that mitochondria is mitochondrial senescence or aging is one of the key factors for a person aging faster than they should or slower than what they should. And of course, the hormonal balance. So we check everybody for their hormones and on a full level and full scope of all your hormones, with your adrenals, your sex hormones, your thyroid, every single insulin. Of course, one of the biggest things with the sugar being an epidemic right now, influencing our insulin production. And then the next part of that aging part is like your environmental toxins, your food, your glycation, how your body is like changing as they're being exposed to all these like foods and toxins and environmental factors, pollutants. And as we age, there is the oxidative stress, you know that with eating so much healthy food and trying to get your superfoods in. So oxidative stress is something that we can actually mitigate and reduce. As we age, we create more reactive oxidative stress. And that is key through our diet and eating healthy and all the natural peptides, we reverse that. And then, of course, the last thing that determines our aging is the immune system. And in that immune system, we know that the T cells, the B cells, our fighters are, as we age, and the thymus gland that determines that, as we age after 30, actually declines. So that's why people start getting chronic disease. And after that, it's cancer later, decades later. So when somebody wants to do stem cells, that's the last part of my immune dysfunction there, where there is stem cell immune kind of senescence. I say, like, wait a minute, we have all these things that we have to go through your pie before we even get into stem cells. So that is the best thing to do, to create a healthy stem cell before you even harvest it. And in the future, those stem cells will be healthy. And even though some people say, oh, we need the baby stem cells, like if you go through that whole pie, your stem cells will be so amazing and healthy. And a lot of that, kind of environmental effects can be reversed.
That was such a great overview of the entire strategy that you actually use in your office. And by the way, if you want to track down Dr. Bar, she is available for you. I think your website is drbarx.com for everybody who wants to track Dr. Bar down. Her and Kelsey over there are just the best ever. We love going over there. It's just fun. I mean, you go over there, you're going to have a good time. And what I loved about Dr. Bar is she just, sat me down. She said, look, if we're going to do, by the way, she can do a stem cell extraction if you want that done. She did that. She didn't do that for me, but in the future, maybe she will. But she can do that for you. I already have my stem cells extracted. And before she put them in, she's like, look, we got to get you in for a prep day. You've got to do these peptides. You got to do these. I think we did a Myers cocktail of the B vitamins and the vitamin C and the glutathione and the magnesium sulfate and all that stuff. And there's just so many great things you've got. So I guess for somebody who's a beginner, Dr. Bar, where do we start them? When they walk in your office, what's step one?
Well, you had your step one in already. It's lifestyle, because the epigenetics is really lifestyle. So I cannot help anyone who is not active, doesn't want to eat healthy, doesn't sleep well, does not want to mitigate the stress, and not in that positive space, right? So if somebody wants to really transform their lifestyle is very key. And we can try as much as we can with all the technologies and pouring money into this, but it won't work because you have to do the work. So you came ready, right? You have an amazing lifestyle. You are, you walk the talk and talk the walk. So I think it's very important to know that people need to eat healthy, sleep well, reduce their stress, take all the steps that can put them in a space where now we can help them 35 years and older. That's where we really need to start working on mitochondria, hormonal balance. Unfortunately, it is as early as that. Humans were not made to live for a long time to be fertile and reproducing. So that's your peak time. And what I like to do for my patients is put them in a hormonal state of peak time. And that is so important because the hormones and the peptides, which is amino acids, little teeny amino acids that are created in our body, actually, it's amazing. Amino acids create the peptides and bioregulators, which I think more and more people will understand bioregulators since the Russians have discovered those, Dr. Cameron. And these are the soup or the fluid that all your cells live in. And you need that optimized milieu or environment for a cell to be able to work properly and not to age, right? So environmental factors, again, are important. So, avoiding toxins, even the chemicals that you use in your home, the food that you eat, the physical and mental stress that you go through, whether it's like being exposed to fumes or toxic waste in the environment. So your water should be filtered. You avoid EMX and radiation in your home. It should be your sanctuary, right? You use essential oils. You create all this positive vibration sounds and light therapy, all the things that actually can make your home your sanctuary, because you're going to be exposed outside when you go out to all kinds of other things that will create stress and increase your inflammation. Whether we like it or not, we live in that, set of life that unfortunately we're trying to improve. But at least if we do half of the time we spend our life embedded at home, it should be a clean, organic, very calming environment with positive high vibrations. And again, if one wants to do a little bit step further, then they might be involved in the IV therapies that help with the anti-aging, the peptide therapies and bioregulators that reverse the aging, and then reverse their immune senescence. And that's what really puts people in trouble. Immune senescence is aging of your immune system. And that, again, thymus is rudimentary by 30. And we need to work on it. And people don't know that because most of your primary cares don't talk about it. It is proactive and preventive medicine that we're talking about, functional medicine.
Greetings, David Avocado Wolfe here, Grand Rising. I'm up early this morning here in Hawaii thinking about our detox. It's already begun. The sooner you join the detox, the better the deal is. Plus, we're already in a group chatting together, people from all over the world, just like you, people who are interested in detox, cleansing, and having the best day ever. The cleaner we are on the inside, the better is our life experience. That's for sure. The key date when the whole thing really kicks off, all of us together on our first call, is May 8th. So you're still out in front. You're ahead of the curve right now. You join right now, you get more value. You can work on more of the supplements and more of the strategies that we're doing to get the heavy metals and parasites out. What do we use against the heavy metals? Charcoal. What do we use against the parasites? Our rug product. And then we progress from there and we get into the minutia of the detox and cleansing and everything you could ever want. We're going to send you the books. You're You're going to get the PDF documents, the recipe books, and everything that we've created over many years of doing these detoxes with over 10,000 people at this point. Now, first week, May 8th is when it kicks off. And so we'll be in a group together leading up to that. You'll get to know other people in that group. People will be answering your questions. You'll get that time with all of us, actually. It's a really good way to kind of familiarize yourself with all this. If you're new, if you're an old timer or in between, everybody's welcome. If you're a young person, you're definitely welcome. If you're a little older, you're welcome too. We got all the strategies for everybody. We've done this with lots of people. May 8th is that kickoff date. And then May 15th and May 22nd. Those are the 3 calls with me. So that first week, we're going to come down to 1 solid meal a day. It's going to be plant-based. We're going to bring our calories down. The second week, and we're going to kick that off on day 8. That'll be May 15th. We're going to, of course, work on getting to no solid meals. It's going to be all liquids. It could be blended soups. It could be juices. It could be just something that you feel comfortable with. Maybe it's going to be tea. I'm having tea this morning, get me going this morning. And then that next week, that third week, kicking off on May 22nd, you can stay on the liquid diet if it's really working for you. We'll talk about how to make that work for any metabolism, whether you're a high protein person or high fat person or high carb person or low on those things. We'll make it work for you. We got the strategies. Remember, we've met every kind of person that's out there and every metabolism that's out there. So we can make this work for you. Get your calories down. If you want to do it with me, I'll be on the water fast on day 15, May 22nd. I'll just keep going and you'll get to watch that process because we don't end the group at that point. We stay together. We're on there until the next cleanse starts. And what a cool way to meet new people from around the world, meet new friends, maybe a new love interest. You never know. All the details will be provided to you on what to do. Again, you'll get the PDF documents. Click the link below or above. The link, by the way, is, here it goes, davidwolfe.com/detox. 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 Detox. In that link is all the details to join us. Let's do this together. Together is always better. See you in the cleanse and have the best day ever. I love that you have such a great selection of different things to do. For example, we did ozone. So you did ozone with us. We did all the, the Meyer cocktails of all the vitamin C's and all those kind of things. And then you also have the peptides, and you are on the peptides. You are at the cutting edge of peptides. I was so glad to see that. By the way, Dr. Bar is so epic that when we first met her, she's like, "What are you guys doing?" We're like, "Hey, we're having this event here in Laguna Beach," and she came. She came to the event, and I was like, "Okay, this is our woman right here. She's on top of it, and she's such a dynamo." I'm not going to tell you what her age is. She's going to have to tell you herself. But for her age, she's just an absolute dynamo. She goes out and she has a lot of fun, and she's a very high energy person. And her and Kelsey running that office it's a joy to be there. It's just the hijinks. It's like a TV show. It's just so fun in there. And anyway, so I guess let's start off with some of the vitamin C and B vitamins and magnesium sulfate, some of that stuff, glutathione, and then let's work into the peptides a little bit. Just talk that through with people because, we got people who've never done even IVs of vitamin C and then take them further than that.
So when we take IV vitamins, it's very important to understand, like you can take your oral vitamins, but it's going to go to your gut, it's going to be absorbed, it's going to be redistributed everywhere. But when we want to just have like a big boost or fast effect on the cellular level, we'd love those IVs to be in. And vitamin C is oxidative, like antioxidant, right? So we know there are 4 factors or 4 things that your body do to detox or clean itself. So this is like your internal cleaning system. Oxidation, which is vitamin C. I like methylation, which is again in that little curve, the pie that we had. Methylation is what destroys your DNA. So if you want to have a healthy DNA, I'm 62. You want to have your DNA. My DNA is about a 30-year-old. So and you can measure that. So your methylation is what really destroys your DNA. Some people are not very lucky and they don't have a good methylation program in their system. So we add methylation, which is methylated B12, not methylated B12. Then we add all your other minerals that you need. That's like your cocktail, your magnesium, your zinc. We add all these nutrients in your IV. And then after finishing that IV, we put you on glutathione, which is your next system for sulfonation. This is the next system that your liver does mostly, like detoxing through sulfur. And nobody's allergic to it. This is your body, it makes it. So glutathione is an amazing antioxidant. And the next IV would be like another bag of NAD, or sometimes we do subcutaneous injections of those NAD, which is your hydrogen. So we're talking about oxygen, methyl, CH3, and then you also do your hydrogen and you do your sulfur. That way you're cleaning every cell and preparing it. That is a really cool way of doing that. We sometimes add a little L-carnitine for your brain and every tissue. Sometimes we add a little CoQ10. So our IV is a little bit different than most, Meyer cocktails. We get them a little bit more on anti-aging level. And then when we do the ozone IVs, we alternate that. That's another very strong antioxidant. It creates oxidative stress and an antioxidation, but it activates your mitochondria, activates your immune system. And of course, we use that with red light, like, the red light that people put on their face. And we use UVB, ultraviolet light. So it's photodynamic therapy. So we take your blood, we mix it with O3. So you're activating all your red cells, white cells, mitochondria, and then take that blood back to you. But it goes through a tube that shines on it red light therapy and ultraviolet light. And that is just another IV that is amazing. And we're adding to the practice also. This is another thing. We're getting it from Germany. You're going to try it next time.
Okay.
Laser lights. So the spectrum of laser, we're going to add the spectrum of laser and the IV goes through your vein, which is like so cool. So these are the IVs that we do. Of course, if somebody needs peptide IVs, we do some peptide IVs as well for the immune system.
And you can also treat injuries. Like, I had a knee injury and you remember directly, and that was crazy. That was still that sore and that irritated after all those months, but it got a lot better right after you hit it with the stem cells. So let's talk us through, Dr. Bar. If somebody has a chronic injury, a hip injury, a knee injury, some kind of thing like that, we can take this whole approach and just apply it to them and even treat the injury directly. Is that correct?
Yes. So we have a lot of athletes. We have a lot of people that got into the sports industry and now they're retiring and now they're feeling the effect. And it's not usually pretty because your joints get beat up, even runners, golfers. These are things that you could do when you start having osteoarthritis, which we call it the aging. Like people say, I'm stiff in my joints, but it shouldn't be anymore. We talked about how we can mitigate aging and reverse it, right? So all these aging and breakdown in your joints could be prevented or early treated even with peptides, ozone, which is O3, Prolotherapy, which is some sort of a sugar actually that you inject and makes the cartilage in hyaluronic acid. You kind of create some moist into your joint again, so it's not stiff and dry. And I love to do all these before doing the stem cells. It's just think about your stem cell as like your CEO. You don't want him to go clean the street. You want to get everybody do the cleaning. And CEO can come in and say, okay, now we need to structure that street, the street that way. Let me do my big job. So I think stem cells are the icing on the cake. You don't want to use them or abuse them in a sense to do the dirty work. You want them to come in and heal, repair, and regenerate. Because if not, they're going to go for anti-inflammation first. Yeah. So
they could be knocked off course, kind of what you're saying. Like you might want to work on an injury, but the person might be older, so they have inflammation throughout their system, and it will go to that rather than to the injury. Is that what you're saying?
Yes. Yeah.
Now, one of just for everybody who's listening, if you want to track down Dr. Bar, if you're in Southern California, she's in Newport Coast, great area right there, and we just love going to see her. We're going to actually see her in a few days. drbarx.com, drbarx.com, and go check her out. She's also got a great book on stem cells, and she's just, at the cutting edge. She is constantly adding to the protocols based on what's being learned. And so that's another thing that's very important. If you want to stay on the leading edge, as I do, I rely on someone like Dr. Bar to be like, okay, now we're getting the laser in. Now we're going to do this. Now we're going to do the stem cells this way. Do you want to give us any other insights on what's happening at the leading edge of your work in longevity medicine?
So I think one of the things that we love to do is basically tailor your program. So this is the one thing that we start doing like more for our patients is tailoring it depending on all the new testing that we're gathering right now from everywhere around the world, which is amazing. So we have more ways of finding out how your DNA is working, how your mitochondria is working, how your hormones are affected through like the genetic part or the closo, which is a protein / gene. So all these new testings that we're doing are going to be so amazing to exactly tailor it to the protocol that you need. And now we can measure. So if you tell me like, I will do the work with you and I want to lose like 5 years of aging, we will shake hands. You're going to say, I am doing the work with you. And we put you on a very specific, tailor, genetic oriented protocol that would be best for you. And every year we measure and you see yourself, going backwards, which is backwards in time. What is his name? Button. What's his name? That movie.
Yeah, right. The time traveler, Benjamin Button. There it is.
Yeah.
What Dr. Bar is telling us is really the leading edge, which is you got to tailor the medicine for you as an individual, your own unique genetics. And when you're talking about hormones, Dr. Bar, let's talk about that a little bit, because that's a big deal, is like how certain hormones can be irritants and lead to proliferation of breast cancer, for example, and certain hormones are very anti-cancer. Do you want to give us a little bit of a background about how you work with hormones?
Yes. And unfortunately, when we get males, for example, into the practice, like, I want testosterone. And that's their all focuses. Like, but men are not made of one hormone, right? Or humans are made of a variety of hormones. And that's very important. So, for example, when I want to address the issue of sex hormone as testosterone, I say, okay, so your brain creates the hormone that stimulates your testicles to create, hormones. So FSH/LH that comes out of your brain, we need to measure it. Then your mother hormone is called pregnenolone, which is very important. It's great for not only creating all your sex hormones down and some of your adrenal hormones, but it's great for your cognition, for your brain's health, for your mood. So I want to check that. And everybody, if they want to be on testosterone, they're going to be on pregnenolone to start with most of the time if it's low, because usually it will drop as we age. Now you go down the line, if somebody wants testosterone, they're young, and it's like, wait a minute, let's check your DHEA. So it's a very important kind of like go through the whole process, like vitamin D, if you don't have it in the top, or cholesterol, all those doctors want to give you cholesterol pills. You need the basic ingredients to create all your hormones along the line. So I don't balance one hormone, especially if somebody wants to come and get their sex hormones balanced. We go through the whole process, because that way it's very physiologic. Most of those men don't need an estrogen blocker. Estrogen is the worst, by the way, hormone in men. If it's in excess, when they start taking too much testosterone when they age, thinking that that's what I need, unfortunately, they start making estrogen. Estrogen is good in small amounts. However, extra estrogen, unfortunately, is made when people take extra testosterone on physiologic doses. And then they start having prostate hyperplasia and prostate cancer. So the estrogen is not only bad for females when they take too much, it's really bad for men when it's too much, because then it becomes a problem for cancer. And then with environmental factors that we now are exposed to, all the xenoestrogens, the mimicking hormone blockers, we are surrounded by estrogen everywhere right now. And unfortunately, men are having more estrogen than they need. So these all need to be detoxed. So whenever you talk about bad hormones, we detox those hormones. And one of my favorite things to detox hormones is iodine. Kelp, seafood, take your sushi or seaweed, So it's very important when you're talking about hormonal balance, it's not only balancing it, but detoxing, for example, estrone and xenoestrogens that are a problem for males and females. So these are important things to consider. I hope I answered.
Very important.
I went on a tangent. Sorry.
That was good. I mean, this is really important stuff, because there's so much out there that says, I need testosterone, or, a woman says, oh my God, my estrogen's this, or of those, let's get into women's hormones a little bit, because I'd love your take on progesterone, because progesterone to me seems to be the most important of the major sex hormones in women. And it's right kind of it's a derivative of pregnenolone. And that was very interesting. You brought in pregnenolone. You almost never hear that even mentioned, that particular precursor for a hormone. What are your thoughts about that cascade from pregnenolone into progesterone and how important that is? And then from progesterone derivatively into other things?
So progesterone is a very important hormone, and it's for men and women. I put men on progesterone as well. Sorry, I didn't mention that. But progesterone is your maturation hormone. So estrogen or testosterone is what replicates the cell, and then mostly estrogen. And then when you want to mature the cell, it's progesterone. Progesterone protects your heart, your brain. There are a lot of studies showing like dementia, Alzheimer happens more with aging because of lack of progesterone. Progesterone have been used for so many years, and it's very safe. However, there's one caveat. There is a difference between progesterone, that they call it in the pharmaceutical industry as progesterone. However, it is not progesterone. It's not made of plants. It's not made of a natural ingredient that your body will take completely and excrete it or metabolize it. The artificial progesterone in the pharmacy that females take in contraceptive pills is progestin. And that's a cancer, unfortunately. It's bad.
It's an instigator.
But I think it's sad. There is a lot of clinical studies and they do not talk about it. They still give it and they say we'll give it for a short period of time. So progesterone is a very important hormone. It's great for our heart, for our brain. It's very important for our sexual health. And I give it for women and men. Even young girls, when they come with really bad, like PMS, a lot of girls are estrogen dominant. I put them on progesterone and we cycle it. So we kind of improve their mood, their PMS. They're feeling great. They're not just losing 7 days of their life, poor thing, every month. And some people don't know that, but it's not contraceptive pills and it's the natural progesterone. And in the United States, we make those bioidentical hormones from yam. And it's not soy, from yam.
Great.
And so your body takes it and completely utilize it. And it's okay.
Yeah, that's really good to hear that. It's so important that because there's such confusion about progesterone out there and it's confused with progestins. It almost seems like it's purposely confused, but you want the natural one from yam. That's more for women. I think probably, it's a much smaller amount for men, but good for men, especially I've seen in the studies, aging men in their 70s and 80s, very protective. Do you believe, just while we're on this subject, do you believe that women live longer than men primarily because their hormone system is based on progesterone? Is that a major reason or do you think that's a minor reason?
Not sure if women are living more than men. There was those studies and the factors. I just like the females are not as privileged as men for that. But I think women on bioidentical hormone are more privileged. Why? Because they don't have to have high doses like that. I was just on a podcast the other day, and then some doctors just want to give you a huge dose. I like almost homeopathic dose. I like to adjust you to the perfect dose that will make you healthy and function on a cellular level. You don't need Superman doses. I get sometimes people come and it's like, I want 200 milligrams of testosterone. Like, why? Or like progesterone, you can adjust it when you're doing bioidentical hormone. You get a compounding pharmacy and they can go from 5 to 10 to 72 to 86 to 150. So it's very important to adjust the dose depending on the person. We're not one size fit like everybody. As pharmaceutical, they would make 100 milligram tablet of whatever or 200 and they get FDA approved on that. But they don't have 110, or 260. But that's what's the privilege of having a compounding pharmacy that would exactly create. And that's why it takes a lot of tweaking between me and my patients to find out what is the best number that is good for them on their dosage. And we stick to it, but we're changing. So it might be 150 for you today. And then 5 years later, it might be 162, but we can adjust it to the very minimum amount. And that's why I was saying, this is my exciting part about what we do in our practice. It's very tailored and personalized medicine now. And we have the tools of doing that.
It's so great to hear all that. Now, because everybody's thinking about their particular case and their life story. Maybe Dr. Bar, you could share with us some testimonials of people who've been through your programs, or just things you've seen that amazed you. That you're like, wow, that person really recovered. Some of the stories I think would help people to be able to apply it in their own life and go, oh, you know what, that could be me, and I could change my life.
Absolutely. So I'm very grateful to the type of medicine that I practice now. So I studied as Western medicine, and I studied in hematology oncology, which was very traumatizing and painful. But I got into this because I was so fascinated by stem cells and gene therapy, and I did my fellowship in that. And that's the price I paid. But then we were doing chemotherapy and we're losing patients, and it's so hard. You would have one protocol and you have to apply on everybody. Not necessarily that's good. You're killing the good, the bad, the ugly still in your body. And unfortunately, these are very sad moments in the practice. And then after that, I transitioned when the stem cells research was cut down. I became a regular practice. I created a community clinic, but most of my patients were not happy. You give them a medicine and they come back for the next one. And then there's a side effect. And that's how we were trained in Western medicine. Like, you have a symptom, I'll treat your symptom. And if you come back with another side effect symptom, I'll give you the next medicine. That's it. No base root of the problem at all. Not finding why you're physiologically have acquired this symptom to start with. And if we take the root of it or the cause, you'll be normal, right? So unfortunately, this is a very sad type of medicine that we practice. And now my practice is very happy. You come to my office and you feel like you're at Disneyland, right? We're having happy.
I will attest to that. We have so much fun over there. It's fun to go over there. Remember, Dr. Bar, you can find her, drbarx.com. Track her down, call Kelsey up and get in there if you can. But anyway, go ahead. You always have such amazing people in there. What are some of these stories that have, just inspired you?
Thank you. So we get happy patients, the most important thing. So once you put patients on a balanced hormone, kind of setup, their life is amazing. Their mood is better. We use oxytocin, which is like if somebody's grumpy, we measure and we find like, oh, he's lacking oxytocin or she's lacking it. Then they're happy. Sexual hormones are amazing. They're feel-good hormones, right? When I put you on progesterone or a female is on progesterone, she's lacking it, not because she's depressed, they're putting her on a depression pill. It's lack of progesterone. She sleeps better. It makes GABA, right? And also it improves your mood. So all this like daily, people coming to my office, they're always happy. But with stem cells and peptides, I think they're miracles. This is amazing. This is what I really love, because I had like one patient who's like, he's been my patient for a while. And I'll tell you this story. He's about like 75-year-old, very active person, and he loves gardening. And he came the first time, he just was making a pool in his house, whatever it is. And he messed up his right knee for the meniscus. We do the MRI. And I said, okay, let's try to do peptides. Let's do the MRI. We're going to send you to my orthopedic friend next door. However, give me 8 weeks. And let me see what I can do for you. So we put him on peptides, and I inject his joints with peptide. I inject his joints every day. He was so good. He comes in, he gets his peptides, he gets his ozone injections for every day. Then just before the 8 weeks, like at week 6, I said, okay, you're a little bit, kind of improving. However, let's do your stem cells. We did the stem cells in. He goes to the orthopedic. And he says, oh my God, you don't need surgery anymore, which is crazy. So tore meniscus and it's 70-some-year-old, that's really hard to heal, which was amazing, And I have so many stories like that. I have athletes like baseball players that also were told that you're going to have to do the surgery. And I would negotiate with the surgeon and say, just give me 8 weeks. I just need 8 weeks. And not everybody needs stem cells. A lot of times we can reverse this by peptides and ozone injections in the joints. And I do them with a little ultrasound. And these are my favorite stories because there's pain, there's lack of mobility. Actually, that patient was so cool. He came and said, I came with a cane and I couldn't get up the stairs, that I used the elevator and now I'm fine. A year later, he tears his other side. He's very active. We fixed it. It's like, what are you, playing stalker? It's so funny. But I think my favorite results usually come from treating patients for their joint injuries or back pain. Back pain is another huge thing because people unfortunately can't do any activities. They can't sleep. They become so grumpy. So we reduce the inflammation. That's very important. And they're told now the only thing we can do for you is an epidural, which is horrible. It's a cortisone shot and lidocaine, right? Like we're gonna numb you. And usually by the third time, it doesn't work. They do the first one, they get a bit better, second one. So I have a lot of these cases that actually is amazing. And people love it because like honestly, when you're told you're gonna go under the knife or you're gonna go under procedure and you don't have to, that's a life changing thing because a lot of times those surgeries really don't. You end up getting cut and you get a fibrous tissue or more pain later after down the road, and you need to do another surgery possibly. But I think that's great. Like if we can prevent somebody from having a knee replacement or cut in their spine and fuse a cord, this is really awesome stuff. And of course, do stem cells. It's always like the fastest way, fast tracking. But we try to watch for the cost.
I love just how you are able to integrate such amazing and difficult to find strategies like prolotherapy. You do prolotherapy all the time. You're a master of it, right? It's not like every day you run into somebody who does prolotherapy for somebody's joints. It's not every day you run into somebody who does prolotherapy and understands peptide and understands ozone and understands stem cells and that holistic approach to treating the person and the joint. So Dr. Bar, you're really like a gem. You really are. And I really appreciate you. And I just feel it was like the good Lord shone down upon us and brought us to you. It was just incredible. Miracle.
Thank you so much. But see, I tell my kids, the day I'm not learning, I'm dead. I'm underground. So I think we have to learn. This is the most important thing. And we have to be flexible because everything like, when we were under siege with COVID patients, like we didn't know what to do with that. But under, functional medicine, that we can treat anything. We can treat anything, right? By learning and understanding what's going on, right? At the root of the issue. And we were able to treat patients with COVID, even though there was no, clue. What are we fighting? It's a toxin. We know that it's fighting these systems. And again, if you have tools through functional medicine, you can always heal anything, You just have to learn and find out who's doing what and what it was done. And a lot of these things, if I give you methylene blue, it's a dye that was like hundreds of years discovered. If I'm doing ozone therapy, it was discovered before the antibiotics. But guess what? It was shut down because the antibiotic business is huge, right? So you can even treat things like mold or, COVID with ozone because, E is going to kill anything. Right.
I'm so glad you brought up mold. Let's do that real quick. I just want to touch on that. If you're dealing with mold toxicity out there, I get that question every single presentation, every single time I'm doing any kind of public call whatsoever. What do we do for mold? So Dr. Bar, you can go see Dr. Bar. She has all kinds of treatment strategies for mold. Do you want to name a few, Dr. Bar, real quick for people?
Yes. Well, first thing to do for mold is get out of where you are. You need to be removed out of it, right? It's so important. And reduce your exposures through the foods and the coffee, the wine, the cheese, all that thing. It's so easy to get that information. The next thing that we usually do, we have to have a good binder to start binding it out of your system, which is important. Help you with healing a lot of the destructive things it does. It affects your brain and cognition. So phospholipids are very important. Reversing all this lipid loss in your brain. Of course, we do ozone therapy for that. It's so important. We do antioxidation. There's so many things that could be done for mold that is like not mainstream, like people don't know about. But it's just the biggest one is ozone therapy, and it's just an amazing treatment for mold patients.
I've been telling people when they do the ozone later in the day to take the charcoal, and then that's the binder. So because ozone kills everything off.
Yes.
And, you have such a die off and it's good to have a nice binder. Any other binders that you like that you recommend?
The combination is a lot of stuff like the clay and the charcoal. I made one and put it together. And actually I made it during COVID because COVID is like SIRS, SIRS is like, in an actually long COVID, patients who had mold that did not know that they are mold patients or Lyme were the ones that were having a lot of long COVID. I saw a lot of people in the beginning. So I treated a lot of patients with COVID in the beginning. And it's like, wait a minute, I'm seeing, and I even have it on YouTube. Like there's a lot of people that not get better. It's been 2 months and and then now they're having foggy brain. They're having memory loss. They're just having like tingling nerves, like all the stuff that's weird. And you just look at it, it's like mold. It's a toxin, and with more evil stuff in it because the clotting and all that kind of stuff, that's so bad. But it's just interesting that a lot of the mold patients, they got to be careful because when they get hit by a COVID, which is still comes in, they will get old.
Yeah, it gets worse. Yeah, that's a very important warning out there. Get your home cleaned up of mold. I've constantly got ozone. I've got a whole ozone system here. I'm bubbling it through olive oil, bubbling it through my room, blowing it around with HEPA filters, charcoal filters, and dehumidifiers. But we're in Hawaii, so it's very moldy over here, and you have to keep the jungle off your house. So many different things that we do here, and almost every single day in one room in this house, we're running an ozone machine just to drop those mold spores to the ground, and then the HEPA filter pulls them and cleans them up. And it's kind of like that in your body, isn't it, Dr. Bar?
Yes. Yes, absolutely. And there are canaries. There are people that are more, kind of susceptible to the infection, that. And some people just live with them in the same house and feel nothing. And it doesn't affect them the same. So not everybody will be as sick. But we see the ones that have been, going under radar and then get hit with COVID. Now they surface and they have a lot of issues.
Interesting. Very interesting. Dr. Bar is in Southern California, drbarx.com. Check her out. Or I think this is your phone number. Correct me if I'm wrong. Call Kelsey up at 949-706-1212, 949-706-1212, and go see Dr. Bar. Check out what she's doing. All kinds of regenerative therapies. It's epic, like best ever. And she's the best ever. And it's super fun over there. And you may even see me over there. I just like to just go over there and run around just with these two awesome women with high-powered people in there. And her whole staff is just a lot of fun. And then check out her book. Give us the name of your book again, Dr. Bar.
Biohack Your Stem Cells by Iman Bar, MD. It's on Amazon, actually. I didn't know how to do this. I was printing it, and then I found somebody to help me to put it on Amazon. And it's on Kindle, actually.
It's on Kindle. Okay, fantastic. I thumbed through her book when I was in the office last time. It's deep. There's a lot of information in there. It's leading edge information. You can tell that Dr. Bar is on the leading edge. Thanks so much for joining us, Dr. Bar. You are the best ever. And I appreciate you so much. And I appreciate Kelsey so much. You guys rock. And I can't wait to see you in just a few days.
What an honor for you to have me on your show. I appreciate it. And thank you so much for just like all this wonderful compliments. I really appreciate it. Thank you so much.
Yay. Awesome. So everyone out there, Dr. Bar and I are wishing you the best day ever. You have all the tools in front of you to achieve your goals. And let's do that together with regenerative medicine. Much love. Mwah.
Thank you so much. Bye.
Aloha.
Aloha.
Thanks for listening to the David Avocado Wolfe Podcast. Did you love today's episode? Please share with your friends and leave us a review on Apple Podcasts. Want more with David Avocado Wolfe? Join us on Substack at davidavocadowolfe.substack.com. Sign up for the newsletter and join the Inner Circle membership on davidwolfe.com. Thank you for listening and have the best day ever.